Hi, my name is Hanadi Nassif. I'm a cardiothoracic nurse here in the Bay Area, and I've been a nurse for around 4 years now. I am thrilled to be applying to San Jose State's FNP program, which is something I've been thinking of doing for a few years now. My nursing experience began in high school when my mom invited me to go to a Stanford-hosted Caritas symposium with Gene Watson. It was really inspiring to go and talk to a lot of nurses that I had been introduced to, and it opened my eyes to the essence of nursing and how nurses promote healing. This experience led me to pursue my BSN at the University of Portland, which had a strong focus on holistic and community and population healthcare, which I know is also a strong focus at San Jose State University. During a summer in college, I requested to have an internship in St. Louis at a functional medicine clinic because I was so interested in identifying and treating the root causes behind chronic problems. While I was there, I also studied well-being coaching through Anthropedia Foundation. I believe that coaching is a big part of nursing because it helps someone become more self-directed, educated, and accountable for their own growth and well-being. I took that mindset to Mayo Clinic for my nurse residency. I chose a day shift position on an adult pediatric cardiothoracic PCU because I wanted a world-class foundation in evidence-based care. I was interested in the cardiac specialization because I had already become HeartMath certified and was fascinated by the heart and its power to regulate all the systems of the body. It's like a mini brain, and it sends more signals than it receives and has a profound impact on mind-body health. And it can be regulated to help us function optimally. The patient population at Mayo consisted mostly of patients that had underwent valve replacements, CABGs, transplants, LVADs, congenital repairs, and medical overflow. I also frequently floated to a variety of floors, including GIGU, ortho, tele, med-surg, and even the CVICU for patients that were more stable. Overall, my experience at Mayo was very positive, and I worked with a great interdisciplinary team, including many nurse practitioners who helped me learn so much about very interesting and rare cases of patients from all over the world. One brutal winter was enough for me, so I decided to move back to the Bay. And since then, I've been a nurse at Kaiser in Santa Clara on a day shift position on a similar cardiothoracic step-down type of unit. The biggest differences are that my current unit has more thoracic surgery patients such as lobectomies, esophagectomies, spontaneous pneumos, and consistent cath patients where we're removing sheaths and assessing and monitoring for stroke and bleeding. These patients have a quick turnaround, staying usually one night or so this adds to the fast pace and challenging workload, often having around 6 patients a shift with admits and discharges. I am also part of Voice of Nursing and Caritas committees, so I have worked on several quality improvement projects, including reducing the amount of falls and hospital-acquired pressure injuries. My unit also has resource nurse role and flex nurse role, which we all alternate having, and these roles have strengthened my clinical confidence, leadership, organizational, and teamwork skills. As resource nurse, I am hands-on working alongside both the CNAs and nurses, helping maintain patient safety and high-quality care, as well as covering everyone's breaks. As flex nurse, we are recovering post-cath patients and also helping out around the floor, often the first to be called when patient condition changes and escalating when necessary. Most patients on my unit have fairly high acuity, and we often catch and correct subtle changes in patient condition before patients reach a totally unstable state. More recently, in my free time, I have continued to learn about lifestyle medicine, integrative medicine, and functional medicine through various programs, associations, newsletters, and articles. My research on these topics continues to inspire and help me in delivering current evidence for patient education. I also know how much more of an impact I could have if I had more time with patients to discuss managing their chronic diseases in a way that brings them hope, understanding, and motivation for self-directed lifestyle choices. I am ready to dive into San Jose State's nurse practitioner program and embrace all it has to offer in holistic, evidence-based training to face the global healthcare needs, many of which we see in this community. Thank you so much for this opportunity.